This
take advantage
conference
of,
will now be recorded.
and then to go forward from there. But why don't we just get right to the heart of the meeting and just start off, and we can hopefully have a robust discussion.
Good. Well, listen, guys, we're going to get into section 1 here with participants. Please add as we go through. I think the first area that we all kind of can take some pride in is the implementation process. Currently, we have sites that have implemented, and you'll see some of those on the data visualization part of this, that are well and truly underway with testing. We have MOUs from 14 sites now, and beyond that, what we've been able to do is establish that we've taken data from the main CRMs and been able to get it into the what we call the national database. We've taken it in from ReferNet, we've taken it in from iCarol, we've taken it in from Resource House, VisionLink, and Service Point. And so that in and of itself is a big accomplishment. And the sequels are all in place now to continue that process as we go through time. The idea that we would be able to create a national database for the opioid program needed to be proved, and you guys all proved that it could be done. So hats off to everybody there. The implementation process, as you guys all know, required work on your side to be able to pull your appropriate resources out of your database, submit them, and then as we went to work on the back end, we made them available for the automated program. I don't know, does anyone have any comments about that implementation process that they'd like to share with the group? Well, I'll take that as good, because that means that, it went off pretty well. We're great to have that process now sort of in the bank, and we're satisfied that we can work with all of you now going forward. Now, the early testing is underway at several sites. And we've got coming up in the second section visual representations of what that is. You've got a couple of links in your agenda that I'll encourage you to use that will get you to both visualized data reports and downloads of your reports, so that as you want to gather your data up, you can. Both have a look at it nationally and locally, by county, by zip code, by your own organization, and we'll go through a little bit of that. But the early testing has resulted in no one coming back to us and saying, "Hey, wait a minute, this isn't working right." Moreover, what we've been hearing is that the early testing is delivering resources that are appropriate, resources that are proximity sensitive, resources that are good to have go out. And, without leaving this early testing segment, I'm going to pull in the chart that shows a little bit of that. I don't know if everybody can see this, but this is data. This is data that has been gathered from the time we began back in June until now, and it's separated here by state. So you'll see your state up there as you've been testing. We've been faithfully collecting that data, and this data visualization chart will be used and will show a little bit more of its flexibility and relevance to you as we get to that part of the meeting. But going back to the agenda now, there's also been some local funding success stories underway. I've asked Tim Sullivan to explain some of that. I've asked Janet from South Dakota to explain some of that, and Larry to explain some of that. And Walter, I know that Kristen couldn't be on the phone, but she has some stuff that she's excited about too. So, Larry, do you want to preface with some of the local funding efforts that you have going, and then we'll switch to Tim, we'll switch to Janet, and we'll switch over to anybody else, Walter, and anybody else who wants to talk about that.
Well, I can just share very briefly that we've been working very closely with our heroin task force, Orange County Heroin Task Force, and they have been a big proponent of the project. They helped develop it, but they also have committed dollars to creating a marketing campaign, which is still underway. And when that's complete, we will share those materials with you. And they have also indicated, but not yet finalized, that they're going to create a position, give us funding for a position to be able to do outreach in the community on behalf of the project as well. So we are hopeful that both those efforts will further enhance the awareness and the effectiveness of the program in our community. We have a number of grant applications out, which I will share with you, to expand the program within our service area and throughout the state of Florida. So we keep looking for ways to fund, and each time we share it, we receive a lot of excitement from the potential funders. Hasn't translated into a lot of dollars yet, but we're optimistic, and I think that regardless, the work that's being done and the success we're having is in of itself a reward.
Larry mentioned the fact that we were going to share all of that information. There's been a Google directory set up where you'll see there under Section 2, a collective local grants and fundraising support package. Those will all be collected so that we can all share in how we've described the program, what we've written. All of that will be available to everyone. I think we've sent some share links out already. If we haven't, we will to everybody, so you can get into that Google directory and pull out marketing materials, pull out background information, pull out local grants that have been applied for, some funded, some pending, and hopefully that'll be a big help for everybody. Tim, can you take it from here?
Yeah, I'm here. I can take it. So about the time that I was Washington 211 was approached regarding the Opioid Text Platform, so state of Washington, just a background, is they're kind of the earlier adopters for the Medicaid transformation, and so it's called Healthier Washington Medicaid Transformation. And so in the state of Washington, we have 9 regions that are testing innovation, and 6 of those regions, I know somebody here is from Ohio, I know was one of the earlier adopters of the pathways. We actually going to be a part of the pathways in the state of Washington too. But kind of part of that work, we've been working with what's called the Accountable Communities of Health, and these are kind of the names for the regions in the state of Washington. It might be called similar in some other states. Anyway, for the last couple of years, we've been having a lot of conversations about some of the innovative work and also the use of 211 resources and some of that work around the social determinants of health. Right when shortly after I got the contact and started looking at the project, the National Opioid Text Project, we got actually a grant announcement for some rapid opioid response grants. These are just small grants, 6 months, to kind of demonstrate unique services that can be done around opioid abuse. And these are actually, so we applied, we got a $10,000, which is the maximum we get for a 6-month project to actually test the Opioid Text platform in a very rural county in the state of Washington. So and this is the largest landmass county in the state of Washington, but it only has 40,000 population. But they also have one of the highest incidences of opioid abuse, and deaths. And so this is a great project. We're very excited about it. We were able to contract with the dollars, contract with Okanagan Public Health District. They hired an outreach person, and he is actually going around the county doing presentations, doing some of the marketing for that, going out and determining new resources to put into our database. And so we just signed the contract at the beginning of actually this month, but some early work's already been done just to kind of get the marketing materials together. So we're pretty excited about this. We're 100% of the dollars that we got from this grant, we're using it towards this demonstration. We want to make sure that it's successful and we create a good model, because 6 months down the road, there's going to be opportunity for more funding as well. And actually, we can expand it to other counties in that area.
Terrific, Tim. Thank you so much. Anybody have any questions at any time, please, just holler right up. I asked Janet from South Dakota to explain how this fits into their work and what's underway. So, Janet, would you give us a little bit of background on that?
Sure, I would be happy to do that. The Helpline Center in South Dakota, obviously we answer the 211 phone number and additional phone lines, but we've had a long-standing relationship with our Department of Social Services and our Department of Health. And so when the opioid federal grants came out for each state, the Department of Social Services contacted us directly to ask about the possibility of answering a statewide opioid resource hotline for them, and also kind of working with them in partnership to create a resource database to ensure that all the resources to receive treatment or information about opioids was available across the state. So we partnered with them and have begun that process. And as part of that, we had a conversation with them because they knew about some of our other texting programs that we had available through Prevention Pays, and they wanted to know about the opportunity of having texting services available with the opioid project. And so we were able to talk with them about this current project, and they were very interested in that, and that's kind of how we came on board, and how the state continues to partner with us to see this through.
That's terrific. The right tool at the right time, so to speak.
Right, exactly. Yes.
That's great.
And so going forward,
go ahead.
I was just going to say, Tom, that going forward, there of course are additional federal grants that are going to be out there for states. And so whether that is through the Department of Health, Department of Social Services, Department of Health and Human Services, it's different in every state. I believe there are conversations that other 211s could be having with their state departments about partnering with them.
That's true. I mean, that trickle down, it seems to be a very common pathway. Federal to state and state out to agencies that are, working the streets, so to speak. You're saying, though, that you believe that that's present in all of the states because opioid is this epidemic is such a highly prioritized issue. Is that your belief?
That's my belief. Yes.
Mm-hmm. As it relates to that, we had some conversations about how to package this, and we're going to talk about some creative marketing strategies, not in detail on this phone conversation. We hope that as more testing goes on and more of the grassroots type marketing goes on, that we can have some more data to help buttress up any kind of response to any kind of state or local grant as may be coming by the 211s. And we feel that as we move through August and September, and especially as we go through some of the stuff in the second section here, that we'll be well positioned to make some announcements to the field about just how this has gone and what it meant, how extensive it was to get it implemented, how the early testing goes, and things like that to help buttress up the requests that I think a lot of 211s would like to make, given you're right. I think in that most everybody's got this on their radar someplace. If it isn't the very top of it, it's somewhere in the top 5 or top 3 issues that health departments and 211s and agencies are dealing with. So that's really encouraging to hear, Janet. Thank you so much for that report.
Sure.
I know, Walter, that there's some stuff going on, that you're outreaching to some folks and that you've got some requests out for some marketing funds. Is there anything that you'd like to say as it relates to that?
Sure. So when our community received the monies, and it was a federal loan from SAMHSA, really looking to engage those who are using opioids, and it's specifically looking at getting them into medically assisted treatment. And what our community did was we followed a model that we were using with youth and families who are at risk and underutilizing mental health services. And we had developed a partnership with ourselves and other groups on the mental health side to develop an outreach team for those folks. So we took that same model where it's 211, it's the substance use disorder treatment groups, and a lot of support from our mental health board. We've also partnered with local law enforcement and the hospitals and the emergency rooms. And we were able to position ourselves to be the point of entry for all referrals to this team. And so the referrals will come to us, and we're able to track all of that data. And then someone from substance use disorder group, and we're also very big on peer-supported recovery here in Ohio. And so a substance use disorder outreach person and a peer support, certified peer supporter, will go out into the community to the individual's home, or they're homeless. We've discussed neutral areas within town where they can meet. And it's just establishing that initial connection with them in the hopes they will become engaged in treatment. One thing that we've been able to hand out to these folks, because we have to meet them where they're at, and not everybody is ready to engage in treatment. And so we were able to hand out a tiny little pocket directory, but on the front of it, information on how they can find the help for treatment when they're ready. I don't believe that it's tied into any funds yet, or that we've received any additional funds, but we also have a long-standing working relationship with our addiction and mental health board. We function as their crisis hotline as well. So I believe it's all really just tied into that.
That's great. That's terrific. So the idea there being is that folks can get information. And like you said, and Larry, I think you could double down on this just a little bit as it relates to the ongoing nature of the affirmation tracks that are part of the recommendations coming from the heroin task force. That as these messages go to people the first time, there's a series of messages that go afterwards, as we all know, that keep those people involved and engaged and things like that.
I hear the most comments from around the country about the affirmation track. How that's really, to some extent, taking the work of 211 and INR to the next level of being not just a connection point, but an ongoing support point. So I think that we should all be proud of making that available to the community.
That's terrific. Yeah. Yeah. No, that's terrific. We've got, so many things that are potential. If anyone else wants to chime in here on how this might work for local funding, if there are processes underway. I know, Courtney, you've got a ton of stuff going on up there in Rhode Island. If anybody else wants to talk about how this program can be used to help support that, that's terrific. Does anybody want to take a minute? Okay.
Tom, this is Tim Sullivan again. I just want to let you know that we actually have interest from another county. It's probably the most second populous county. It's next to King County, where Seattle is, and they actually meeting with the Pierce County City or County Council next week to develop actually an opioid navigation program with 211 using the text platform as part of that navigation service. So it's probably a big expansion for us into this area. We're pretty excited about that too.
Oh, great. Great. Well, of course, guys, that was the hope. The hope was that this would be a project that would be serving two masters. One would be a local master that we can all use to meet needs in our local community. But as we stitch it all together, that it will become, as we've been able to, get this data in and make it all available, it will become a predicate for a larger national program. And if it goes up through the normal channels, or if there's a funder that wants to take it down from the top, we're positioning ourselves with your hard work to be able to look at both. Larry, there was some stuff that you were going to talk about on the national funding efforts, and marketing number 5 should be discussed, and new resources. So I'm gonna skip now up to new resources number 4. And say to you that we've had new resources come in from Atlanta since the time we made the initial upload. And we think we're going to get some new resources in from South Dakota, because there's been some new resources that they want to add to the system. And just this morning, Tim sent in an email with some new resources from Washington. And that's terrific. We're able to accommodate that, and as we get those requests, we'll process those as fast as we can. We're working hard to try to keep the data as up to the moment as possible, and when new resources come in, we want to be sensitive to that, so that you get exactly what you want delivered through the service. It's going to be easiest for us to take them in small lots whenever they become available. Don't wait. Don't compile them and push them all to us 3 months from now or 2 months from now. Kind of do it as you get them, and that'll make the job a little easier. We are able to overwrite if, for instance, there are, all of a sudden hundreds of new resources that you want to have be put in. We're able to use the sequels to overwrite the data that's in. That's available to us. And as we go through time, we'll refine systems that enable us to work through APIs and things like that. But please don't be bashful. Any new resources that you want to push up, please do. Your contacts on that are myself here, and our agency will take them from you through email. We'll pass them along and make sure that they get to Heart of Florida. Diane, who has been rigorous with her work on the back end of this, has them properly associated to the taxonomy terms and the lookup modules. So things are working smoothly there. Dan, thank you so much for your oversight and keeping that all on the straight and narrow.
Not a problem, thank you.
Okay. We're going to push marketing into the creative methods for deployment in section 2 of 2. But national funding efforts, Larry, you wanted to talk briefly about some new stuff that's going on there.
I did actually. Thank you. You know, just as people in your communities have heard about or in your state have heard about the text pilot and reached out, we've also been in discussion with a very large nonprofit that has a huge presence in the addiction arena. I wish I could share the name, but we just signed an NDA to not do that at this point. But we are in discussion about opportunities related to shared data and to joint fundraising. What excites me about this possibility is that they have a robust database of over 30,000 vetted resources, and of that, about 10,000 of those resources are directly related to youth and young adults. So what we have done is we gave them the Heart of Florida resources related to opioids, and they gave us the reciprocal resources they have for our footprint, and we're seeing, you know, what the process looks like to put the data into the database in both databases. I am cautiously optimistic that we'll get this done, and so I think it opens up opportunities, as I mentioned, for joint fundraising, but also creates a very robust national database of resources that have been vetted along with our resources that really creates a truly national resource for opioid addiction and other issues related to that. So I think there is a huge potential, great marketing efforts, great fundraising efforts, and just a great, like a better term, stamp of approval on the whole process if we're able to put this in place. Now, obviously, before we do this, we'll have numerous discussions with everybody on this call to make sure it makes sense. But it seems right now to be a good thing to move forward. We are continuing to work with our state senator Marco Rubio, who has, you know, is on the appropriations committee and continue to talk about earmarked dollars. I'm not optimistic, but he, you know, his staff is. We have been bouncing this off the CDC and other places, as well as some corporate partners to see what their interest is. But I think if we are able to put together the great pilot, which we've done, and potentially have a national presence, we will eventually get the funding that we want to have happen for this to be successful for all 211s.
That's great, Larry. Thank you for that. Any questions on that part, please chime in. Okay. As we skip into the section 2 here, the local grants and fundraising support package, I've lightly explained that. That will be a Google directory that you'll be able to access, clearly marked with high resolution imagery for marketing, background on the grants, background on the project, I mean, for grants and for fundraising support. And the availability of that can be commonly shared and added to as more and more develops. We think that it'll be a great package that will be in an open environment that people will be able to get to and use as they want, and that I think is a high objective for us in August. That I think has already been created to include some of the marketing materials and some of the background data. If you don't have your invitation to get into the shared directory, you soon will, and it will be something that I think has good value for everybody. So we're excited to do that, and as that dovetails into creative methods for deployment, I wanted to share with the group something that was sent into us by Pathways, and it's their 211 stewardship program, which is a way to use your resources, your providers, to be your marketing partners. And you guys are all probably doing this to some degree anyhow, but we thought from a creativity standpoint that this could be capitalized on. And basically what it does is it establishes with your hundreds, if not thousands of provider partners, a means by which to get out information about this opioid availability, this information and getting the facts on opioid availability. We think that it's a strategy that can bear fruit. So we're going to undertake to build a package that you can send out and ship it to you all, but a package of information that you can ship out to any of the providers that want to participate in something like this, to hand out to their clients and to their associates, so that we're using the strength of all the people that we know to help shoulder some of the loads of what you might call grassroots or guerrilla marketing, until such time as we're ready to go with a big national push. This seems to us to be a very clear path towards getting the word out in areas where you want to selectively, and the term we like to use here is narrowcast instead of broadcast, but selectively narrowcast program availability through the resource partners that you have. We'll put some more meat on the bone over the next couple of 3 days and start to work with you guys on a selective basis to help create some of that material. If anybody would like to volunteer to be on the review of those materials early on and help us in the formative process, please let me know, and we'll be happy to work with you closely on how that package comes together and how it can be easily turned into something that can be fulfilled to every one of your resource partners that would hand out that information. Does anybody have any comments on that? Okay.
This is Tim again. We just kind of ran into a little stumbling block with. So we are using, actually, I just want to say thank you, Larry, for sharing your materials. We're actually duplicating those and localizing them for our project. But with the text platform, so we have a pretty large Hispanic population, monolingual, and so the text program really it's not translatable. So we're actually having to market a little bit differently to that population, at least now until there's a change. So we're actually encouraging those folks to actually call 211 instead of using the text platform.
Well, that makes sense. We do an awful lot of work with our populations across the United States that are monolingual and bilingual, Spanish speaking. It would be something that in the next iteration of this, we would have a different keyword like we have done in so many of the emergency and disaster type situations that we've been involved with, that is 100% done in Spanish. It's not on the drawing board yet, though, Tim. So give us a little time, though, and it'll be there.
Well, thank you. I just wanted to bring.
Yeah, I'm glad you brought that up. We can translate the shell of the program into Spanish. The challenge is all the resources would still be in English, so we'd have to that'd be a phase 2 part. We could definitely make the first part, including the affirmation, in Spanish.
Has anyone, let me ask the group, is there a separate subset of Spanish resources that are available in the CRMs now?
I think, I don't know about anybody else, we use Google Translate when we have to do.
On our online database has it.
Our online database uses Google Translate for the Spanish part. But
Yes,
the shell itself can be done in Spanish relatively easy. It's the other part of it that's the challenge.
It's the written record of the resources. Sure. No, I understand that.
Right. Well, I think that's very important. Though we need to figure out how we address that.
I think you're right. I think that what would happen is in the tracks of information, we might be able to give them good, solid facts that can be translated into Spanish. We would be able to give them encouragements to come back in and call 211 as we're currently doing, or text 211 as we're currently doing. That's food for thought. Thank you, Tim. That's food for thought.
Well, I have another comment on that. So since it's linking back into the national opioid database, I mean, if you had everything, the scripting all done in Spanish, which wouldn't be too difficult, couldn't, if they link into the resources and click on that, I've seen how it works, goes into the national database. Wouldn't at that point, could you use a Google Translate at that point of connection?
We could definitely do that, yes.
Mm-hmm. Good idea. Good idea. I've got that as number one work in progress. Actually, I think that's a terrific idea. Thank you. Let's though say that we're working on creative ways to help you deploy. I want to move now to these charts and graphs that are available for everybody. Hopefully this will help with some of the work underway. You can see here that we are dealing with the ability to both visualize your data, and you're able to get it by your organization. That's this pull down bar here. You're able to get it by referrals, by requests, and by unmet needs. You're able to isolate it to a state, to a county, to a zip code. You can select that easily. So if I was to say go to Louisiana or any of the other locations, you can see that Louisiana in a very short time frame has put out these referrals as a test. That can also be looked at by zip code. I think you guys might remember all of this. Both of those happened in the 70113 area. This bar here changes the view to Washington. So we'll reload the data and put a time frame on it. Just a second. Sorry. I'm going to reload this to New Jersey and put a time frame on it. This allows you to pick the time frame. And you can see that it will load up based on referrals given as it relates to that. So hopefully this is really good stuff. This is live data up to the minute. So you can use this URL that's in your invitation, in your presentations. You can use this in your reports. We feel that this has got enormous value in both of those ways. It will give you the ability to see in what areas you're getting a lot of your information coming back from. It should be a direct reflection on any marketing efforts that you're putting out into those local areas, because these numbers will grow. And that's why we wanted to make it sensitive to zip code. The other thing that's new here now, you've seen these charts before, but the other thing that's new here now is this data export. Back to the invitation for a second. So if you click on that and you go to this site, what you're going to be able to do is you're going to be able to put in your organization. You're going to, again, be able to pick a start date. You're going to be able to pick an end date. You're going to be able to pick your organization. And you're simply going to export the data file. And when you do that, your data file that exports and downloads comes back and looks just like this. New Jersey, I hope you don't mind. We used yours as an example. But this is what you get when you export that file. And it's a complete record. This is just a couple of days worth of testing that they did. 2 days worth of testing. This is a complete record of everything that was sent out, right, by the system. So again, contacts that were made, organized by the phone number, unique identifier, organized by the time, additional information, as you can see. And we hope that by instantly being able to gain access to this resource, it will be valuable to you. Let me just go back to it. So again, use that URL that's in your invitation, and this is that tool then that allows you to export your data. Okay.
Hey, Tom, this is Amanda from Iowa.
Amanda.
Hey, have you guys figured out when you would be implementing all our information that I gave to you guys, and when we're going to start testing all that?
Yes, we've got it all in, save for the ones that Amanda, that you redefined just I think yesterday with Dayanne. Dayanne sent me a note this morning saying that they were going in. So you can test now those, I think, 6 or 7 resources that needed to have some further clarification. We'll start to pull back within a couple of days. Right now, we're adding some new resources for Tim. We think we're going to add some new resources for South Dakota. We added new resources for Georgia, United Way, Greater Atlanta. And so please don't not test the system. Test it and make sure you like what's returning.
Okay, thanks, Tom. Appreciate it.
Okay. Right. So we're moving up on an hour here now. So is there any other open discussion that you'd like to have? We feel that what we'd like to see happen in August and September, as is possible, is some of this grassroots marketing, some of this deployment, get your numbers up, start to really, track this as a very valuable tool for contacts made. And we're here to support that every way we can, so that we can help with that, with the generation of numbers, because like any good bit of research and or program implementation, early data, preliminary data is the key to then broaden out the work to more regional and national dissemination. And your early data, I think, in your local markets is going to help you with, as we talked about a lot here, and thank you so much, everybody, for contributing on local fundraising efforts. We so applaud that. And it's like a dream come true to hear that there's, grants out there that are being considered and grants out there that have been funded. That's just terrific news. Larry, you want to button us all up?
Sure. I just once again want to thank everybody for all the work they're doing to make this available to their communities and to support the work we're trying to do to get national funding for everybody. I know there's been some bumps along the way, but we keep moving forward, and I think that every day there's new opportunities and a lot of reasons to be excited about what's going to happen in the future. So once again, thank you.
Good. Good. Well, I guess with that we can adjourn a little bit early. It's a Friday. Why not, right?
Why not?
Thank you, Tom.
Oh,
Yeah,
Thanks,
thank you
Tom.
all.
yep.
Thank you.
A wonderful weekend.